Are you suffering from baldness and you are planning to go for a hair transplantation? But while searching where to get it done, you are getting confused by having so many options. So today's topic is about how to choose your hair transplant surgeon. Hair transplant is a cosmetic procedure and it's all about your look. There is no urgency. So before going for hair transplant, do a proper research and you have to keep certain things in mind where to get it done. Coming to the first point, who is your hair transplant surgeon, which is very important. Keep one thing in mind, that you are choosing your hair transplant surgeon. It's not the clinic, because the surgeon is going to perform your surgery. What are the criteria you should look for while choosing a hair transplant surgeon? First is the qualification of your doctor. So though in India there is no such regulations and many doctors from different specialties are performing this surgery, but MD or DNB dermatologist or MCS plastic surgeons are the authorized person to do your hair transplantation. So you must check for the qualification, credential of your treating hair transplant surgeons. But hair transplant is part of your hair loss journey. Anybody who has expertise in treating your hair loss and also the hair transplant, you should prefer them. Coming to other than this qualification, second is experience. Experience is not about the number of years, it is all about number of surgeries. Because suppose some doctor is doing like 1 or 2 surgeries in a month, then you must prefer a doctor who is doing this surgery regular basis and also doing it daily, and major practice is hair transplant. Then coming to degree of involvement. So basically hair transplant is a long procedure which is being performed for a period of 6 to 8 hours, maybe more than that, depending upon the number of grafts you are planning. So there are various steps involved in the hair transplantation. First is anesthesia, then planning, designing, slits making, then graft extraction, and then last part is the plantation. So out of all these things, planning, designing, slit and graft extraction are the most crucial steps. That means if your doctor is getting involved throughout the procedure and is present physically during a hair transplantation, then this must be your preferred location. Coming to second point, though hair transplant is a minor procedure, but it is performed for a longer period of time. The setup must have adequate space. You should have dedicated setup for the hair transplantation. There should be proper maintenance of the sterilization so that there won't be any chance of infection while or after the procedures. And also, though it is a minor procedure and it is performed under local anesthesia, still this must have facilities for any emergency to tackle. Suppose some emergency happens, there must be facilities to tackle the situation. So setup is most important, including hygiene, sterilization. Other than this, team. So the hair transplant surgeon or hair transplant clinic must have a dedicated team, not like the freelancers. Third and most important is the result. While you come for consultation, look for the pre and post results of the hair transplantation being performed by your hair transplant surgeon. You can ask for reference. The clinic must be able to provide you some reference of the old hair transplant done patient. Most important factor is like results. So hair transplant is basically a cosmetic procedure and it is all about look. So if you have an unnatural result, you have to carry that unnatural result throughout your life. Second thing is, so in transplant what we are doing, we are taking this finite donor from back of your scalp. So once it is finished, if in future if you need another procedure, you may not have adequate donor. It should be natural, along with it should be a proper management of your donor. The result should be dense enough to give complete coverage, and hair transplant is part of your hair loss journey. So hair loss is an ongoing process. The doctor who is expert in managing both surgical and medical management of this hair loss, you should preferably choose that hair transplant surgeon. Because suppose you have only baldness in the front and you have done transplant over this area, and this area there is good amount of existing hair. So you must take care of this existing hair to prevent any further transplant in future. So the center must have adequate facilities for both hair transplantation and also for hair loss management. Other than setup, you must look for what is the technique being used for your hair transplantation, type of instruments, quality of instruments, whether they are using magnifications. So these are very small steps, but is a very crucial steps in deciding your final results in terms of natural regrowth and also in terms of density. Before choosing your hair transplant surgeon, Keep all these things in mind, take your time, do proper research, then you plan your surgery accordingly. Thank you.